Abortion advocates here in Pennsylvania are raising concerns about proposed state funding for crisis pregnancy centers. Fox 43's Alyssa Kratz has the story.
Reproductive health care advocates are calling on the Shapiro administration to redirect millions of dollars in funding which are currently being proposed for crisis pregnancy centers.
It's a new administration, and so there's a lot of conversations that need to happen, and so that's why we're here today. We want to make sure that we are part of the conversation, particularly at a time when we know Pennsylvanians need to access sexual and reproductive health care.
This comes as the Appropriations Committee reviewed the 2023-2024 budget proposal during Tuesday's Department of Human Services budget hearing, which includes $6.3 million in taxpayer money, along with an additional $1 million from the Federal Temporary Assistance for Needy Families program, all appropriated under women's service programs. Planned Parenthood believes these counseling centers mislead patients and provide no medical care, but pro-life advocates say they're doing essential work in our communities.
In 2019 alone, they gave over $5.6 million to over 60,000 Pennsylvanians through goods and services. So we're talking parenting classes, diapers, formula, strollers, cribs.
DHS clarifies the department does not directly fund these centers, but since 1995, the General Assembly has required it to administer grant funding for programs that provide alternatives to abortion services. In a statement to Fox 43, a DHS spokesperson says, quote, "The Shapiro administration unequivocally supports the right to choose and access to the full scope of reproductive health care. These services are essential, and Pennsylvanians deserve honesty from those they trust with medical care or counsel. Alternatives to abortion are options for those who do not wish to parent but would like to carry their pregnancy to term. But based on reports from other states, there are serious concerns regarding potentially deceptive practices employed by certain crisis pregnancy centers nationwide. DHS's funding is the result of legislative action, which the department must abide by." End quote. All state budgets must be finalized by June 30th. Alyssa Kratz, Fox 43 News.